An emotionally arousing experience releases hormones which will enable you to deal with that experience in the future because you'll have a stronger memory of that particular set of circumstances, and you can use that information to make decisions about what you do in the future.
But people with PTSD appear to have an overly sensitive amygdala. Even a harmless sound can set it off. Again and again, the traumatic moment is involuntarily recalled and relived, repeatedly activating the amygdala and releasing adrenaline, each time searing the trauma deeper into the memory centers of the brain.
Post-traumatic stress disorder is simply ordinary emotion and memory gone haywire. It's gone too far. It's using a very adaptive mechanism for a maladaptive purpose.
If PTSD begins with a jolt of adrenaline, can blocking the effect of adrenaline stop PTSD before it starts? In the emergency room at Massachusetts General Hospital, where Johnny was treated after his accident, scientists have been experimenting with a new treatment. If it works, it might spare traumatized patients a lifetime of nightmares and anxiety.
Why not see if giving a beta blocker, a drug which blocks the action of adrenaline, why not give that to subjects who have had a traumatic experience so that even if they relive the situation, even if they have these flashbacks, they won't have the adrenaline making too strong a memory.
In a carefully controlled study, traumatized accident victims were given the beta blocker drug as soon as they arrived in the emergency room, and then 4 times a day for 2 weeks. The preliminary data suggest that by interfering with adrenaline's impact, beta blockers can stop the vicious cycle of post-traumatic stress disorder in its tracks.
If post-traumatic stress disorder can be weakened or blocked, then there is a way to prevent this disease. And until now, there has not been one. So that's pretty big news if it turns out to work out that way. There'll always be the memory there, but the hope is to prevent that from becoming so strong that it takes over the life of the individual and becomes not just a strong memory, but it becomes a very significant emotional disorder.